Hey everybody, and welcome back to another video here at Whiteboard Medicine. We appreciate you checking it out. Hope everybody is having an alright day. Maybe there's some sunshine you're enjoying or relaxing, or maybe you're at work on the way to work. But nonetheless, we appreciate y'all and appreciate you checking out the video here. Today we're going to be talking about the measles outbreaks that are going on right now. There are a handful of outbreaks, the biggest one obviously being in Texas. So we're going to be talking about when that started, how it spread, how sick people are getting, what type of people are getting sick. We'll talk about the other outbreaks popping up in other states. We'll talk about how this compares to traditional outbreaks and numbers of measles cases in previous years. And then we're going to end this with an overview on all things measles. This is going to be a video we've covered before. It's kind of what we call public health essentials. So we're going to add that to the end of this video. If you've watched that video already, obviously feel free to watch it again. But for those that have not seen it and are interested in this topic or want to learn more about the measles, what it is, the symptoms of it, how you catch it, transmission, incubation period, vaccination, treatment, all those things. We'll talk about vitamin A, which is on the news now, and certainly vaccination. Definitely stick around for the end of this video because we're going to be going through all of that. No further ado, quick 30-second break for introduction. Don't go anywhere. We'll see you right back. Everybody, and welcome to Whiteboard Medicine. We appreciate you checking out the video. Here at Whiteboard Medicine, our goal is to create medical education content for all types of interested learners. That includes videos, practice questions, study resources, and much more. We would love for you to join our community by subscribing, hit that bell button. We're also working to build a high-yield Patreon page. It's going to be full of practice questions, video outlines, notes, commercial-free content, and much more.
None of these videos are intended to be acted upon as medical advice. Please pause the video here and read this disclaimer in its entirety.
All right, thanks for sticking around. So all over the news cycle, we're seeing all sorts of headlines on measles outbreaks. And 2025, this year, has not necessarily started very strong. We've seen a big outbreak that has been spreading that started in Texas, in Gainesville, Texas, in January, about a month ago. And what we know since then is that the cases that started to spread all over. We'll talk about this a little bit more, but the R naught, which is if one person gets measles, let's say this young person unfortunately got the measles, how many people they can spread it to. And if a population is unvaccinated, they actually can spread it to up to 18 people. So one case can spread 18 people. And then each individual person of those 18 can spread it to another 18. Right? And that's how things exponentially increase. That's in an unvaccinated population, though. As the vaccination percentage in the population increases, that number goes down and down and down. And that's something we'll talk about towards the end of the video, so stick around. But in Gainesville, Texas, this started to spread. And what we know is that since the start of it, cases have increased to 159 at last check during this Texas outbreak alone. Right? Measles is one of the most contagious infections in the world that affects humans. Of those 159 people, unfortunately, 22 of them were hospitalized. And we'll talk about complications of measles towards the second half of this video. But a lot of those complications include things like pneumonia. You can get severe neurologic dysfunction. And these are the two things that people most often get super sick from. It certainly causes rashes and fevers and congestion and red eyes, and it also can cause things like ear infections or otitis media. It can cause laryngotracheal bronchitis or inflammation of the airways, but these are the two things that people most often get super sick from. Okay, and of those 22, unfortunately, one kid passed away, died from the measles, right, from this disease that for a little while was thought to be kind of eradicated. So there has been one death in this Texas outbreak. In the symptoms that we most often see with measles, they call them the three C's: conjunctivitis or redness of the eyes, all right, coryza, and cough. Coryza is kind of congestion, so they call it the three C's. And then you start to get this red rash. It starts on the head and it travels down the face, into the neck, trunk, arms, and then down into the legs. So it's kind of this descending rash. And you can get high fevers as high as 140 degrees Fahrenheit, sometimes even higher. And we're going to talk more about that in the latter half of the video, but these are some of the symptoms that suggest measles. So this outbreak in Texas started in January. 159 people affected, 22 hospitalized, and one actually passed away. What do we know about the ages of everyone, though? Are these older people passing away, younger people passing away? Who's getting hospitalized? Who's actually getting sick? Well, the age ranges of these cases in general, you can see that 53 of these cases were people less than 4 years old. YO, years old, less than 4 years old. So really young kiddos. Um, 74 of them were 5 to 17. So if we combine those two numbers, we're going to botch the math. 74 plus 53, 120, 127-ish. So about 127 cases are less than 17-year-olds. So again, kids, some very young, some a little older, but tons are less than 17 years old. So this is a disease that is affecting a lot of kids in that area. There's 27 who are greater than 18 years old. So a small minority of patients are greater than 18 years old. So this is a disease that in Texas has been affecting the kids in that population. And of those who have been vaccinated versus unvaccinated, who has been getting this? Well, what we know is that those that we have a confirmed vaccination status of at least one dose, and remember for measles, it's actually 2 doses of MMR that's recommended, but those with at least one dose, only 5 of the people who have caught measles in this outbreak have been vaccinated with at least one dose. So a huge small percentage, that was an oxymoron, a small percentage, not a hugely small percentage, although I suppose that kind of abstractly makes sense, but a small percentage of people who have caught measles in this outbreak have been vaccinated, and with one dose, so that wouldn't even qualify necessarily as fully vaccinated. Now, 74 are unknown status, so that might lend more that some of these unknown are vaccinated. We just don't know that yet. Or it could be that many of them are unvaccinated. Again, we don't know that. What we do know, though, is that 80 of these patients who have gotten measles have been unvaccinated. So if we just take away the unknown, which I acknowledge is somewhat manipulating the data, and then we use the full number. So 5 of 159, this is 3% we know have been fully vaccinated. And again, we don't know what these 74 are yet. And then 80 divided by 159, this is 50%. And again, we don't know what these 74 are. So it's hard to totally digest these percentages, but just to give you a rough ballpark estimate, the vast majority of these patients are unvaccinated. And vaccination is really protective. But Texas isn't the only state that has had cases in 2025. New Mexico, bordering Texas, has had 9 cases of measles, and this is actually spillover from this outbreak, right? All the cases that have been in Texas and spreading have started to spill over into neighboring New Mexico and caused a small outbreak there. And what we know is that 4 of these cases are less than 18 years old. So 4 of them are kids, but 5 are actually greater than 18 years old. And these kids that are less than 18 were unvaccinated UV. The 5 cases that were older, we actually don't know their vaccination status, so that's unclear. But again, a common trend here that a lot of people who are getting sick with the measles are those that are unvaccinated. All right, so New Mexico saw spillover from the Texas outbreak. Texas in Austin, the city of Austin, Texas, also has 1 case of the measles, but this is not connected to the current outbreak. This was a kid who traveled overseas and then returned and caught the measles that way. So there's no contact with the other Texas outbreak, but 1 case in Austin. And again, we said the R naught can be up to 18 people. So we might see more cases in Texas, in Austin, depending on if this kid who got infected with measles has been around those that are unvaccinated, just because this is such a contagious disease. There's 3 cases in New Jersey right now, 3 cases of measles in New Jersey, 2 in New York City, NYC, 1 in Georgia, and then 2 in Alaska. All right, so we're seeing a lot of cases across multiple areas in the country, but certainly this Texas outbreak is the biggest one. And there's concern those numbers are still going to go up, right? Just because, again, it's so contagious, especially in an unvaccinated or minimally vaccinated population. So if we look at U.S. cases in 2025 in general, published by the CDC, what we see is that there have been 164 cases total. This is a little discordant with the numbers above because those numbers are a little more accurate and updated, but about 164 cases total. And most of these cases, the majority have been in 5 to 19-year-olds, but the vast majority have been those that are less than 19 years old. Okay, so what is this? 82% of measles cases in 2025 so far have been in those less than 19 years old. 18% 20 plus and 1% unknown. And 95% of those who have been infected by the measles have an unknown or unvaccinated status. And it says unknown, and tough to, again, digest that, right? Is there a huge number that are actually vaccinated? It's unknown. But we do know that only 3% of people that have gotten the measles in 2025 have one dose of MMR, and only 2% of people that got the measles in 2025 have 2 doses of MMR. So this would suggest at least that the vaccine, as we have demonstrated in the past, is highly effective in preventing the measles. There's been 20% of people hospitalized in 2025 who have gotten the measles, right? So 20% of cases hospitalized, 32 of 164. So this can be a severe disease. Some people have mild disease, but this can be a severe disease. You can be hospitalized, okay? Kids have been the majority of hospitalizations, right? So you can see here 16 of 55, 10 of 79. So the young kids under 5 years old are the more likely ones to get sick. So 29% of those less than 5 years old that have gotten the measles have been hospitalized. 13% of those 5 to 19 have been hospitalized, and 17% of those greater than 20 have been hospitalized. But our little kiddos are the ones suffering from the measles, and there has been this one death, which was in a child as well. Very, very, very sad and unfortunate that there's been so many patients hospitalized, and also that a kid actually died from this. We wanted to compare this to 2024. Is this typical? Is it not typical compared to our usual cases? What we know in 2024 total, there was 285 cases. So what is it right now? March 6th. It's March 6th, and in 2025, we already have 164 cases. So it's concerning that this is going to be a year where there's lots and lots of measles cases. All right, because in 2024 in total, there's only 285 cases. And the numbers shook out in general that very small percentage of patients who got it in 2024 were vaccinated, especially had 2 doses of the MMR. So the vast majority of people who got in 2024 were unvaccinated. And we just wanted to finish the first half of the video, and then we'll go into the second half, which will kind of be a big overview on all things measles, with this R0. And R0 is if one person gets the measles, how many people can they transmit it to? How many people can catch it? And it's a measure of how contagious a virus is. And the R0 for measles is 12 to 18. So one person can spread it to 12 to 18, and each one of those then can spread it to 12 to 18 more people. And that's how we get this just exponential spread. Okay, this is in an unvaccinated population. When they've studied this, what they have found is that as the percent of population gets more and more vaccinated in a community, this R0 drops way down. And the number people talk about is if 95% of the community is vaccinated against measles, that R0 actually decreases to just one. One person can spread it to one person. So think about that. Goes from one person to one person to one person, eventually dies out, compared to one person to 18 people. Each one of those 18 people spreads it to 18 more. Then whatever 18 times 18 is, those spread it each one to 18 more, and that number just gets out of control. If we do a little math experiment here, let's see, we're going to pull it up. 18 people times 18 is 324, times 18 more, 5,800, times 18 more. Oh, that was times one more, times 18 more, 104,000. Obviously, that's not what we're suggesting is going to happen, because there's a large percentage of people vaccinated. But this is why in the past, and you'll see in the second half of this video, there was hundreds of thousands of cases of measles a year before vaccination rolled out. So we never tell anybody what to do, but measles affects our young kiddos. Measles can be severe. People can be hospitalized. People can die from it. And vaccination is highly effective in protecting against it. There's a lot of headlines out there about vitamin A and vaccination, all those things. So we definitely encourage you to stick around for the second half of this video, which we're going to queue up right now, because we're going to go over all those things. So stick around. We appreciate you watching this first half. Now transition into the second. All right, thanks for sticking around. So the measles, the reason that this was hot on our mind is because unfortunately, many of you may have seen that we recently, depending on when you're watching this video, have had a handful of outbreaks. The biggest one is down in Texas, and it spilled over into New Mexico. And unfortunately, just recently, a young child died from measles during that outbreak. There also is currently smaller outbreaks in New Jersey, as well as actually Kentucky. So this popped in our head as a topic that would be great to kind of do a deeper dive on, so we have a more comprehensive understanding of what the measles is, how it works, how to treat, and all that good stuff. So starting with just general historical outbreaks, we thought it'd be interesting to look at how many measles cases there usually are each year. And this is the CDC data. This is a graph from their website, and it's number of cases starting from 2000 to 2024. Okay, and then down here we have 1995 to 2021. So we'll start with this graph at the bottom. And back in the 1980s, so measles vaccination actually started in the late 1960s, and they ramped up vaccination kind of advertising and distribution up through the 1980s. And we can see that there was kind of a little peak outbreak in the early 1990s, but since then, for a lot of the 90s into the early 2000s, there was very few measles cases in the US. If we go into 2008, 2012, and kind of have a zoomed in view, right? Because this view here is kind of zoomed out, where back in the 90s, there was almost 30,000 cases per year. And then there's a few cases, but because the peak year is 30,000, we can't really see these numbers that well. So if we zoom in on 2000 to 2024, we can see that the vast majority of years, 2000, 2004, 2008, 2012, these go in 4-year increments. Cases per year were less than 200, right? Less than 200 people were getting the measles per year. Still too much, but that's great. You can see here before COVID, right? This is 2016, 17, 18, 19. There was a little ramp up in measles cases. There had been a handful of outbreaks, if anyone remembers those outbreaks. There was lots of discussions on measles vaccination during that time. But then COVID hit and cases plummeted. And during kind of the time when there was COVID, there was very few cases. Well, COVID then resolved, it's still circulating, but the pandemic status that caused a lot of those cases has improved to a degree. And we're starting to see kind of an uptick in measles cases again. This is in 2024. And obviously 2025 so far, we already talked about Texas, New Jersey, New Mexico, Kentucky, all already have different outbreaks of measles. So our cases this year most likely will be higher than they were in 2024. But typically, ever since vaccination kind of went into full force since the 1980s, cases have been very, very low, which is excellent. If we look at the world stage, though, this is the World Health Organization data, and this is their graphic from their website, and it's 2017 to 2025. And you can see blue is Africa. This light blue is the Americas, green is Eastern Europe, Eastern Mediterranean, orange is Europe, well I guess it's red-orange, real orange is Southeast Asia, and then yellow is West Pacific. And you can see here that earlier on there is big spikes, and it's particularly Africa in the blue that sometimes has these really huge cases. In 2019 there was 541,000 cases worldwide. And luckily this went way down, but this time here, right, was what? It was COVID. So after COVID started to quote-unquote improve, you start to see cases come back up. And the primary areas that have cases tend to be green, Eastern Mediterranean, right here, blue, which is Africa, and then this red-orange, which is Europe. And these areas tend to have the most cases. You can see a lot fewer cases in Southeast Asia, West Pacific, as well as light blue, which is the Americas, which you can't really see much light blue in this area at all. So worldwide, there are still hundreds of thousands of cases each year, right? 2024, 334,000. 2025, there's already been 3,000 cases. So worldwide, there's still hundreds of thousands of cases. That's why you see a lot of vaccination efforts going on worldwide, since it is a preventable disease. If we scroll past and look at the countries in graphic representation, dark blue is more cases, light blue is less cases. And you can see the Americas is very much light blue. So there's kind of very few cases compared to the global spectrum, which dark blue is a lot of cases. And you can see that in Africa, you can see that up here in Russia. You can see in Asia and the West Pacific, not a ton of cases. In Europe, there's certain countries that are more hotbed than the rest of the continent in general. But Africa, Russia, and its surrounding countries, the West Pacific, the Pacific has a number of countries that have some increase in cases, but it's not really universal. So Africa tends to see a lot. Russia and surrounding countries tend to see a lot of cases globally. So still very much out there on the global spectrum. But what is it? Measles virology, virology being how the virus works. This is actually a rendering of the measles virus itself, rendering from an electron microscope where they look with this really powerful microscope and then they make it into a graphical representation. And what you can see are all these kind of spikes on the surface of the virus. And these spikes are in the maroon color, hemagglutinin, and in the gray color, fusion is the name of the protein, or H protein and F protein. H protein for hemagglutinin, F for the fusion protein. And the hemagglutinin protein binds to the cell membrane. This virus only infects humans, so it binds to the human cell membrane. The fusion protein, on the other hand, is what helps the virus fuse to the host cell. And when it fuses to that host cell, it injects its internal genetic code into the human host cell. And the fusion protein helps the virus penetrate that human cell. And once it gets into that human cell, it replicates into a ton of additional copies, explodes out of that cell, and then goes to infect others. And we have a little video clip here that helps us see this. This is not specific to the measles virus, but it does show you how how those receptors attach to the human cell, and then it kind of fuses with that human cell, dumping its internal content into that virus, or sorry, that dumping the viral internal contents into that human cell. The measles virus is from the morbillivirus family, and it is a single-stranded RNA virus, RNA being ribonucleic acid. That's compared to DNA, deoxyribonucleic acid, which is the human genome, although we certainly make RNA as well. And this is an incredibly contagious virus. It is one of the most contagious viruses actually in the world. They estimate that if you're around this virus, that 9 out of 10 people will catch the disease. So it is incredibly contagious. It's really, although bad, but a miracle of kind of evolution that this virus is so contagious for humans. When we look at the symptoms, so you are unfortunate enough to get the virus, to quote unquote catch the virus. What are the symptoms? Well, we break up symptoms into days after exposure. So a lot of people have an asymptomatic period. They're still contagious often for a portion of this, which we'll talk more about. But for 7 to 14 days after exposure, you start to develop symptoms. And those symptoms tend to be a really high fever. Measles is notorious for a super high fever, 104 degrees Fahrenheit, 105 degrees Fahrenheit, which is something that not a lot of viral infections lead to, that high degree of fever. And then you get what we call the 3 C's: cough, coryza, which is a runny nose, and conjunctivitis, which is redness of the eyes. And we have some pictures below, which we'll get into. After the symptoms start, so 2 to 3 days after symptoms start, a lot of people develop these tiny white spots in the mouth called Koplik spots. And then 3 to 5 days after symptoms start, you start to get this classical rash for measles. And the rash is this flat red rash, maculopapular we call it. In medicine, maculopapular. But it's this flat red rash that starts often at the hairline and then distends down. So if we draw a human, the rash starts up in the head at the hairline and then extends down into the face, into the trunk, arms, legs, and eventually into the feet as well. And what we see is that patients often develop small raised bumps at the center of each rash. And if we go to these pictures, these are from the CDC website. The 3 C's, right? Cough, coryza, and conjunctivitis. You can see redness of the eyes in this poor kiddo. You can see a lot of kind of coryza or runny nose. And although we can't hear this person, they certainly had a cough too. So those are the 3 C's that start 7 to 14 days after exposure. Koplik spots are those white spots in the mouth. You can see it here. You can see it here. They do take different forms. Sometimes they look kind of more bluish. Other times they actually look more reddish. Other times they actually look more whitish than even this. And they can be on the palate, they can be on the gums, they can be in the buccal space. See them, maybe some are down here too. And then this is the rash. And I wonder, can we zoom in a little bit? Let's see if we can zoom in on this so you can get a better view of it. And you can see that the rash is flat. It's red. But in the middle, you can see a lot of kind of raised little bumps, right? And this is a classical rash for measles, starting on the hairline, the face, and then descending down the body, right, into the trunk, arms, legs, feet. So this is a classical measles rash. Let's see if we can zoom back out to what we were at. Perfect. So when you have these symptoms, How long after exposure do you start to develop them? And then how is it transmitted? How do you catch it? We started to talk about that a little bit. The incubation period ranges from 7 to 21 days. So on average, that equates to about 11 to 12 days. That means you were exposed to someone who had measles, exposed to a person who is positive for measles. You caught the virus from that person. This is you. Sad. You will not develop symptoms even though you have the virus for 7 to 21 days. That's the incubation period. How long after you catch the virus before you develop symptoms? And the virus is just replicating inside of you, starting to cause that infection. Unfortunately, you are actually contagious 4 days before and 4 days after rash onset. So you might be contagious when you barely even have any symptoms. And then you are contagious for 4 days after you develop the rash. So how is it transmitted? Well, we already talked about how this is one of the most contagious diseases in history. Well, suppose we can't say that, but at least in recorded history. It is tremendously and incredibly contagious and transmissible for humans based on those fusion proteins and hemagglutinin proteins it has on its surface. The way it is transmitted is primarily through droplets. So someone who's infected sneezes, let us mute that, sneezes, coughs, breathes heavily, and they get droplets out into the environment. And then you breathe these in, right? If you breathe these in, or it gets in your eyes, or it gets in your mouth, any mucous membranes, you can catch the illness. In addition to that, if droplets contaminate surfaces, someone sneezes on a doorknob, you then touch the doorknob and rub your eyes, pick your nose, put your fingers in your mouth. All of that can then get you to get infected with the virus. All that can transmit it to you. So viral particles in droplets that get on surfaces that then you get on your hands and then touch your mucous membranes. This is why hand washing, masks and stuff are so important in diseases like this. And they estimate, and we have not verified this with any official evidence, but a lot of people say that if you're around someone with measles, 9 out of 10 people around that person will get infected if they're unvaccinated, right? Hugely, hugely contagious. All right, what's next? Diagnosis and treatment. Well, the diagnosis for measles is often done in the healthcare setting, and you can do serum testing where you test the blood for antibodies, specifically immunoglobulin M. There's a bunch of different types of antibodies. Antibodies are what our B cells, which are immune cells, secrete to fight infection. And they're kind of these Y-shaped proteins that attach on to viruses or bacteria. And if you draw a patient's blood, you can test it for these antibodies, because if you have these antibodies, it means you were previously infected. But specifically IgM, because IgM is the antibody that's secreted first when you have an infection, whereas IgG sticks around for years and years and years. So if you're IgG positive, it just means sometime in the last many years you had the measles, where if you're IgM positive, this is more of an acute infection, because IgM starts to disappear with time, and instead IgG starts to increase. In addition to that, there are PCR testing. You can do swabs of the nasopharynx, so through the nose, oropharynx of the mouth and the throat. And you can actually test the urine as well. And then you run it for RT-PCR, looking for the measles RNA. And we've talked about PCR polymerase chain reaction testing on here before. It's most typical to collect multiple samples because it increases your yield. Every one of these sampling methods has a risk for false negatives, meaning it's negative even though you have the disease. So often you collect multiple samples to then ensure you kind of get every possible positive case that there is. For treatment, most of the treatment is supportive care, but in children, we do something interesting. In children, we actually treat them with vitamin A. And the reason for this is that the measles virus actually suppresses vitamin A. And we see that patients who are vitamin A deficient often have, I shouldn't say often, but are more likely to have severe disease. So in children, we will treat them with vitamin A. If they're less than 6 months old, they get 50,000 international units. If they're 6 to 12 months old, they get 100,000 international units. If they're more than 12 months old, they get 200,000 international units. This is primarily reserved for children at risk for severe disease or who have severe disease, often those that are hospitalized. This should be done with a physician. No one should be kind of freestyling this at home. Obviously, this is a treatment that is administered by people in the healthcare arena, not freestyled at home. Otherwise, it's just supportive care. meaning there isn't any antiviral to treat it. There isn't any medication. It's just supporting the body and organs while you hopefully recover. How do people recover? What complications are there? Well, people who are healthy without a lot of comorbid conditions, most of them do fairly well. Okay, most of them kind of have those symptoms we talked about: cough, coryza, runny nose, red eyes, maybe some Koplik spots in the mouth, maybe that rash, maybe some fevers, and then they recover. But patients who are really young, really old, immunosuppressed, or just unlucky can have complications. And those complications range from otitis media, which is just an infection of the inner ear. So this is an ear, you're looking into the ear canal. This is the tympanic membrane, also known as the eardrum. Then this is the middle ear, right? This is where your hearing apparati lives. And you can get an infection in this middle ear here called otitis media. And you can get that from many viruses, many bacteria, one of which is measles. You can also get bronchopneumonia, right? So here's a pair of lungs. Pneumonia is where you get infection of a part of the lung, because the lung is filled with thousands and thousands and thousands of these small little balloons called alveoli, and these alveoli inflate and deflate when you take a breath, and that's how you exchange gas, but they're very thin-walled. So when you get an infection in there, you get all this kind of pus in these really thin-walled alveoli that are like balloons. And when they get filled with pus, you lose surfactant. Surfactant is what greases those alveoli and keeps them open, and then they collapse down. And when they collapse down, they can't exchange gas, which is why sometimes when you have bad pneumonia, you can't breathe. Your oxygen levels drop. You get hypoxemic. So measles can cause bronchopneumonia. It can also cause something called laryngotracheal bronchitis. Itis is inflammation. So it's inflammation of the larynx, of the trachea, and of the bronchi. Right? The larynx is, you have your vocal cords that go down into your trachea. All right, and the larynx is the part of the, I guess, neck or throat with the vocal cords. So you get inflammation of the larynx, the trachea, and the bronchi, laryngotracheal bronchitis. And you can also get some GI symptoms like diarrhea. The things that people get really, really sick from are often bronchopneumonia, and then it can cause encephalitis as well. 1 in 1,000 people get acute encephalitis. Right, we said itis is inflammation. Encepha, we don't know what that actually stands for, but possibly brain, because encephalitis is infection of the brain. And this can often lead to permanent damage, right? Permanent neurologic damage. Maybe you're permanently weak, maybe you're permanently confused, maybe you permanently have seizures. But 1 in 1,000 people get acute encephalitis. This can also kill you. This can be deadly. So if you don't die from it, you can have actually permanent damage. 1 to 3 people out of 1,000 actually die from measles, right? So 1 to 3 out of 1,000 patients die from measles, often from pneumonia or respiratory failure or from encephalitis. So that's, still way too many. This mortality rate, it's not the highest, right? It's 0.1 to 0.3%. But if you're the person that does get it and die, that is still one too many, given it's a preventable disease. So the other thing to note, and a thing you'll see, is measles has this interesting chronic complication, and it's called subacute sclerosing panencephalitis. And what this is it's this slow, persistent infection of the central nervous system, the CNS. And often patients recover. This is usually kids, usually young kids less than 2 who get measles. They often recover and are asymptomatic for years and years, 6 to 8 years. But then they start to develop these neurologic symptoms. They get weak, they have trouble walking, they maybe get tremors, have trouble speaking. And these neurologic symptoms slowly progress, and this is untreatable. It's a neurologic catastrophe. Many of these patients go into a deep, deep coma, and often die from their disease. And there's no treatment, there's no way to reverse it. So this is rare, it is not common, but even if you recover from measles, you do have a risk of getting the subacute sclerosing panencephalitis. Can you imagine if just 6 to 8 years later, you randomly started getting these neurologic deficits? And again, the highest risk population are young kids who get the measles, who can progress to this. But again, quite rare. So how do we prevent measles? We just talked about what it is, how to get it, how to diagnose it, incubation period, transmission, complications, but how do you prevent it? Well, the best way to prevent it, which many people do, is one of the combination vaccinations. This is the most common MMR, measles, mumps, rubella, and it's usually a 2-dose series If you get one dose, there's a recommendation to get another dose as an adult. But when you get the 2-dose series, it is 97% effective in preventing measles. The 1 dose is 93% effective. When you actually look at the range for the studies, 2 doses is either it's 67 to 100%, and 1 dose is 39 to 100% effective. So they're very effective vaccinations. The most common regimen is you get your first dose of the vaccine at 12 to 15 months old and your second dose at 4 to 6 years old. Again, if you only got 1 dose as a kid, sometimes they do recommend adults get second dose if you only got 1 dose as a kid. The other thing is if you do get exposed, there is post-exposure prophylaxis, and this is if you can't show evidence of immunity. Let's say you didn't get vaccinated as a kid, or you got vaccinated but didn't develop titers, and you have a bad measles exposure. If you get the vaccine within 72 hours of exposure, there's protection, and if not, you can get IV immunoglobulin within 6 days of exposure. And this is where they just pool a bunch of antibodies and give you those antibodies to fight the measles infection. You don't want to give both of these at once, because one will make the other ineffective, but you can get either the vaccine or IVIG as post-exposure prophylaxis if you're in a high-risk group, okay? Hopefully that was interesting. Let us know what thoughts, comments, questions you have down below. Hope everyone is staying well. Check out the page, subscribe, hit the bell button, check out our Patreon page. We'd love to have you in our Patreon community. And if nothing else, stay well, keep learning, and we'll see you all next time.